A recording of today's presentation will be available on the members-only site of farmcrediteast.com for playback at a later time. If you have trouble accessing this recording, please call Christy Schmidt at 1-800-562-2235. Now, without further ado, I'll turn it over to our moderator, Jim Putnam.
Okay, good morning, folks. Really appreciate all of you who are on the line with us. This is the 6th webinar of our continuing series during 2012. And one of the things that we continually hear from our customers is, quite frankly, a lot of anxiety about the health reform law and how that's going to kick in over time and what the impact is going to be on agricultural employers. And so this is really the second webinar we've had on this topic. I think Bob Noonan was with us in 2011 and presented on it. But as you all know, we're getting closer to a lot of these things kicking in, and so the timing here at the end of 2012 is very appropriate. Our goal with our Knowledge Exchange webinars is to share information that's important to us as a financial services cooperative, but we think is equally important to you as agricultural business managers and operators. And so again, it really is our pleasure to have you sharing in this session with a lot of Farm Credit East staff today. So with that, I'd like to welcome Robert Noonan. As I mentioned, second time that he's been with us, and did a great job the last time. I know I learned a lot about the health care legislation, and I look forward to learning some more today. He is a practicing attorney and the founder of Robert Noonan and Associates here in nearby Middlefield, Connecticut. He served as the Vice President and Counsel for the Connecticut Business and Industry Association, previously worked 20 years in HR for the Pitney Bowes Corporation. He's written a lot of papers and texts and so forth on various HR issues, and he's also worked with our good partners at the Connecticut Green Industries Association. So with that, no further ado, I'd like to introduce Robert Noonan to you. Before you switch the voice, Christy, though, I do want to remind all of you, we welcome questions. Please text those in. Because of the kind of the logistics of the webinar process here, we will take those at the end of the formal comments, but very valuable part of the learning process here is your questions. So we really encourage good questions. Text them in, and we will take them in order. So, Bob, welcome back. Take it away.
Oh, thank you so much for having me. We'll take in, it's so great that we have an opportunity to discuss healthcare reform this morning. There is a great deal of apprehension about it, and healthcare reform is now moving from, well, the wholly political and theoretical to the operational. This is the culmination of a considerable legislative effort that began on March 23rd of 2010. And as you all know, it made its way through a number of revisions, and then that very dramatic moment where the Supreme Court ruled that healthcare reform was constitutional. With that, healthcare reform is now going full speed ahead, and we're at the point where employers will be talking with their employees about healthcare reform. By way of background, our organization, our firm represents employers primarily in matters of employment and employee benefits, and we do a lot of work in benefit litigation, and healthcare reform has been part of the work that we do. We do have a special relationship with the Connecticut Farm Bureau and Connecticut Landscapers, a number of the green industries. And so the impact of healthcare reform on those industries is of particular importance because there are some nuances in healthcare reform that apply to the agricultural employer in particular. Now, in terms of what we're going to do this morning is we're going to take a look at healthcare reform from a chronological view, and then I want to review with you the individual mandate that will affect virtually all of your employers. Then the employer mandate, which applies to those of us on the call that have 50 or more employees, and then some special topics in terms of implementation. And then we're going to look at the Connecticut laws and then the other states that are working on healthcare reform in the states in which our audience resides. Now, in terms of the broad impact of healthcare reform and what's been going on here, since March 23rd of 2010, what we've had is a national undertaking to set the stage for a mandate on January 1st of 2014 where every American has to have adequate health insurance. And employers with 50 or more full-time equivalent employees have a special obligation to provide it. Now, that 50 or more full-time equivalent is going to become a very important element for those of us on the call this morning. We're going to talk a little bit about that. But between 2010 and the upcoming January 1st, 2014 mandate, what we've basically been doing is setting the stage whereby there is a marketplace for people to buy insurance. Individuals have to have insurance. The difficulty is in having a place where that insurance can be accessed. Between 2010 and 2014, we've been setting the stage for that mandate. We've been making some changes in group health plans that have affected insurance carriers. We have made changes that affect hospitals in physician groups. And now we're getting to the point where employers will be talking with their employees about health care reform. In 2014, the individual and the large employer mandates take effect. And then between 2010, and you'll see this all the way through 2018 or so, there'll be efforts to reduce the cost of health care in Medicare and in Medicaid, and there's going to be a general effort in wellness and prevention. And employers are going to have some incentives to provide wellness programs in the workplace. Now, the current matter of the fiscal cliff that we hear every day in the news, and will for the next couple of weeks, I presume, is related to the fact that healthcare reform has raised the eligibility for Medicaid, thus making it a greater financial cost to the states and to the federal government. And that's all part of this broad impact of healthcare reform. In terms of the chronology of healthcare reform, one of the things to keep in mind, and this came up when people were talking about if Mitt Romney had been elected. He said in his first day of office he would repeal and replace healthcare reform. And you know, that would have been a monumental undertaking, because when this law was passed in 2010, there were a number of reforms that took place on a year-by-year basis. So let's take a look at what healthcare reform has done and will do in terms of the changes mandated through the Affordable Care Act. There are some new provisions that took effect in 2010 concerning rate reviews. In 2010, insurance carriers were prevented from rescinding contracts, except in the cases of fraud or misrepresentation. But an insurance company could no longer just tear up the contract and say, here's your money back. There was a program for early retirees reinsurance, so employers could be reimbursed for that. For small employers, that is fewer than 25 employees, and some of you on the call I suspect are going to fall into that group, there is a tax credit that was available and still is and will be for small employers who provide health care coverage to the workforce. Now, there are some caveats to that. It has to be a modestly paid, as the law defines it, workforce, and the employer has to pay at least half of the premiums, but nonetheless there's a tax credit that was and will be continue to be available. Kids up to age 26 can be on mom or dad's plan as a dependent. There are no pre-existing, as of 2010, any pre-existing condition exclusion in an insurance contract applying to kids was eliminated. In 2014, one of the big changes in healthcare reform is that in 2014, there will be no pre-existing condition exclusions in health insurance contracts, which means whether a person has a current medical problem or had a history of a medical problem, that history or that current condition cannot be used to exclude the person from coverage. There are no lifetime limits in plans. There are restrictions on what a plan will pay. There are annual limits on plans, or reduced year by year beginning in 2010. There's coverage for recommended preventative services, and one of the things you're going to see in your health plans this year, if you haven't seen it already, and next year, is your health plan will be providing a number of preventative services without deductibles or copays that were not there before. There are some consumer appeals protections and process that self-insured plans had to put in, and there were some, there will be changes in terms of what's called economic discrimination testing. Now, in 2011, employers were supposed to provide the cost of the coverage, health insurance coverage they provide to their employees, on the employee's 2012 W-2. That was deferred by a year. There was a new form that went out concerned, it's called a summary of benefits and coverage, that now you are providing or should be providing to your employees. We'll talk a little bit about that. Insurance companies had to spend 80 cents or 85 cents of every dollar that they received in premiums on clinical services. It's called the medical loss ratio. And if they didn't spend that threshold, those threshold amounts, they were required to send checks back to their customers. And this year, some of the checks went out to customers. They weren't great amounts, generally speaking. There were grants that were supposed to be provided in 2011 for you to start wellness programs with your employees. Those grants had not been issued. Prescription drugs, in order to be reimbursed under a flexible spending account, had to be accompanied by a prescription. The penalties for spending money from a health savings account on non-qualified distributions went up, was increased. And there was supposed to be a program about community living in assisted support services whereby employees would have, you would be setting a payroll deduction plan for your employees, and they would, through payroll deduction, have a benefit for living at home rather than being in a nursing home. That program was put on hold by the federal government. Now, we're coming up to the current events, and this year and next year is when healthcare reform really begins to take on a special relationship between the employer and the employee. This is really the year, this year and next year will be the year when you will be talking with your employees about healthcare reform. The first manifestation of that is a benefit coverage summary. Benefits, there is a report that you are probably going to be provided and have been provided by your insurance company called a summary of benefits and coverage. And that's a form, a standard report by which people can look at their health insurance plans by a common set of characteristics. And your health insurance carrier has probably provided you with those reports, and the government is saying before people enroll in your health plan, you're to give them a copy of that report and a copy of an insurance glossary so they can make a decision comparing, for lack of a better description, apples to apples about which plan they should enroll in. This year, this coming year, you'll be required to provide your employees with information about health insurance exchanges in your state, and we'll talk a little bit about that. But in 2013, in March of 2013, you'll be getting out information to your employees about the health insurance exchange in each of your respective states. In 2013, there'll be standard terms and conditions and insurance policies. FSA contributions, flexible spending account contributions will be limited to $2,500 per year. The Medicare Part D donut hole, drug subsidy donut hole, will begin closing, and it'll close entirely in 2020. And then there'll be quality initiative reporting. And what that really means is this: hospitals and doctors will be posting statistics about their case types and volume so that a consumer, a person, can look at healthcare institutions and make decisions about where to obtain services. In 2014, there is the employer mandate. So on January 1st, 2014, employers with 50 or more full-time equivalent employees will have a requirement to provide affordable and essential healthcare coverage, minimum benefits that are affordable. Employers with 200 or more employees will automatically enroll new employees in the group health plan. The definition of small group, which is an important distinction in insurance, will expand from 50 employees up to 100 employees. There'll be insurance exchanges by which your employees as individuals and you as a small employer can obtain insurance. Now, that's not the only place you can get insurance, and frankly, you're going to see exchange plans and plans sold outside the exchange. But each state is required to establish a healthcare exchange. If they do not, then the federal government is required to set those up. There'll be a new product framework for small groups. There was a free choice voucher that was repealed. That small business tax credit that I mentioned for employers with up to 25 employees provides for a credit of 35% for the premiums paid by the employer. That goes up to 50% in 2014. Every plan that had an annual limit for benefits will have that annual limit removed in 2014. Every plan has to have minimum health benefits, and those are mandated on a state-by-state basis. And there will be guaranteed issue and guaranteed renewal of health plans. It is a very, very big change that says in 2014, people can get insurance on a guaranteed basis. That is, regardless of whether or not they have a health problem or a health history, they can get coverage. Small employers will be able to buy health coverage on the exchange, and it is guaranteed to be renewed. And so it's not going to be based upon claims history. It's a very, very big change in the traditional divisions of insurance between individual and group insurance in this matter of pre-existing conditions. Let's talk about the mandate because for you on the call who are in and around that 50 employee level, the mandate becomes extremely important. Now, we're going to talk about the individual mandate subsidies and then the large employer mandate. And I hope you'll see how these weave together. So the first place we're going to go is the individual mandate. Then we're going to talk a little bit about paying for coverage, and then we're going to talk about the large employer mandate. So let's talk about what people have to do. Effective on January 1st of 2014, every person has to buy insurance or have health insurance for himself or herself and that person's dependents. And the person has to report the status of his or her coverage on the person's income tax return. Massachusetts, for those on the call who are from Massachusetts, the folks in Massachusetts will recognize that in 2006, the Commonwealth of Massachusetts passed the first healthcare reform law. and it took effect in 2007. In Massachusetts, uses the tax return as the mechanism for enforcement. Now, politics aside, it is the Massachusetts law that serves as the model for the federal health care reform law. And just as Massachusetts says we will use the tax return as the mechanism for enforcement, that's exactly what the United States government will do as well. So come January 1st, 2014, every person in the United States has to have health insurance for himself or herself and that person's dependents, and they have to report the status of their coverage on the tax return. Now, they have to have minimum coverage. Minimum coverage means they're in a governmental plan, Medicare, Medicaid, TRICARE for veterans, or they're in an employer's plan that meets the minimum definition requirement. I can assure you that in your states, you will see the insurance carriers issuing plans that meet that minimum coverage definition. So if we have an employer plan or we have a governmental plan, it's going to meet that standard for coverage, minimum coverage. It's got to be minimum affordable coverage. Well, here comes the problem. What happens if I don't get the coverage? Well, the United States government says, in that case, you're going to pay a fine. What's the fine? It's $95 in 2014, $350 in 2015, $395 in, $395 in 2016, and then it's, of course, multiplied for family, and then it's indexed thereafter. And so what this really means is for highly paid people who do not get coverage, the maximum cost for a highly paid individual who doesn't have health insurance coverage is estimated to be somewhere around $4,000 or so. The penalties for most, however, are relatively small, $95 in 2014, $350 in 2015. Now, there are going to be some limits on that individual penalty. If the person doesn't file a tax return at all because the person does not make enough money, there'll be no penalty involved. If the cost of coverage is greater than 9.5% of the individual's household income, well, the person won't be subject to a penalty at all. So for the people who are not making a lot of money, they have to have health insurance coverage, but if they don't, the penalty won't apply. Well, let's talk about the problem, though, of the person that is making enough money to be in the exposed to the penalty, but who says, that's fine, but I can't afford the coverage anyway. Well, the United States government has said, fine, what we will do is we will give you a premium credit. You can get a tax credit if you're falling into your income makes you susceptible to the penalty, but you are claiming that you can't afford the coverage, we're going to give you a helping hand. Now, the people who get the helping hand are going to be people whose incomes, your employees, whose incomes are up to 400% of the federal poverty level. Up to 130% of the federal poverty level, those individuals are eligible for Medicare or Medicaid. I'm sorry, Medicaid. Between 130% and 400% of the federal poverty level, Uncle Sam will give individuals a helping hand, a financial helping hand. And it means this: the federal poverty level is roughly, as a rule of thumb, let's use $10,000. So 400%, 4 times the federal poverty level, is a person making $40,000. For a family of 4, 400% of the federal poverty level is about $89,000 or so. So Uncle Sam is saying to people that we wouldn't consider to be in financial need, look, when it comes to health insurance, if you're a family of 4 and you're making less than about $90,000, we're going to help you pay for your coverage. So that's for the premium credit. We're going to help you pay the premiums on your health insurance coverage. The individual says, well, that's fine. I appreciate that. But the fact of the matter is we have deductibles and co-pays and out-of-pocket costs, and I can't afford those either. The United States government says, that's fine. What we're going to do is provide you with a subsidy. If you go off and get coverage on the exchange, we're going to help you pay for it by giving you a premium tax credit and then a cost-sharing subsidy. And those subsidies, again, are based upon the federal poverty level. So if a person is earning between 100 and 150% of poverty level, federal poverty level, the United States government is going to pay for almost all of those copays, 94%. Between 150% and 200%, it's 87%. Between 200% and 250% of the federal poverty level, it's 73%. And up to 4 times the federal poverty level, it is 70%. Now, I want to go back to the fact that the definition of federal poverty level means someone who's making $40,000 a year or so and who files a single-person tax return, whereas for a family of 4, it's about $90,000. Think of the people in your organization and the level in your organization who will qualify for those subsidies, because for the larger employer, this is important. Let me review something for just a second. These premium credits, the premium credit and the cost-sharing subsidy are available to an individual who goes out and buys coverage on the exchange in your state, and the United States government has to help pay for that coverage. And again, it's going to be people, single filers up to $40,000, or family of 4 up to about $90,000. And Uncle Sam is saying, we're going to help you pay for your coverage. Now, this has implications for us as employers in the large employer penalty. Large employers will incur a penalty if they either do not offer coverage at all, so we're not going to provide any health insurance coverage, or the coverage is inadequate. It doesn't meet that definition of minimum essential benefits, or the coverage is too expensive for the employee, which is going to be a particularly problematic area for us as employers. Now, the mandate is typically not understood by people. And so it's great that we're together on this call this morning because I think it's helpful to understand exactly when the mandate applies. You will hear, as we approach next year, you are going to hear probably around March or so, and thereon, radio articles, you'll hear it on TV, you'll see it in newspapers, statements concerning the employer mandate. And some of those statements, I suspect many, maybe perhaps even most of those statements are going to misrepresent really how the mandate operates. So let's take a look at this. The employer penalty requires employers with 50 or more employees to provide coverage. If the employer does not offer coverage, or the coverage is inadequate or too expensive, and please look at the slide part, that third element that says, and an employee receives a premium credit or a subsidy. The employer penalty applies when an employee of yours goes off and gets coverage on the exchange and Uncle Sam has to help pay for it, which means if we had, for example, an organization, I sometimes use the example of an organization that has, it's a physician's practice and it's got 50 brain surgeons and they all make $225,000 a year. Well, and the employer says, well, I'm not offering coverage. Man, they got 65 employees and the employer's not offering coverage. Is the employer subject to a penalty? The answer is no. Why? Because none of those people will qualify for a subsidy. If they go off and get coverage on the exchange because the employer doesn't offer it, none of them will qualify for a premium credit or a subsidy because they are all making too much money. They won't qualify. Let's take that same practice full of surgeons, except for one person. They have a receptionist. And the receptionist will qualify for a premium credit or a subsidy or both because the receptionist's income is considerably lower than that of the surgeons. When that receptionist goes off and buys coverage on the exchange and the United States government has to help pay for it, then and only then is that employer going to be penalized. So it's important to keep in mind that this penalty is triggered by two things. One, the employer doesn't offer coverage, or it's inadequate, or it's too expensive. And two, the employee goes and gets coverage on the exchange and Uncle Sam has to help pay for it. Now, large employer. This is very important to us on the call and to folks in your industry. A large employer is 50 or more employees, but the problem is this. It's not 50 full-time employees. It's 50 full-time equivalent employees. Now, the law defines full-time as 30 hours a week or more. So what we have to do is count up all our full-timers. So those that work 30 hours a week or more are going to be considered a full-time employee. That counts as one person, regardless of the numbers of hours they're scheduled to work. Most of us say a full-time job is 40 hours. This law says it's 30 hours. So if someone's scheduled to work 40 hours or more, that's still just one full-timer. We then have to count up all our part-timers. And the part-timers are going to be the equivalent to a full-time employee. So if we have part-timers that work 15 hours a week, that part-timer is 1/2, 15 hours over 30, 1/2 of a full-timer. Now, what's very important is the matter of seasonal employees. The number of full-time employees excludes those full-time seasonal employees. Now, the problem with the definition of seasonal employee is this. A seasonal employee, as this law defines it, is one who is hired on a seasonal basis. Many of you have those. And they work less than 120 days during the year. Now, in some of the organizations we work with, our firm works with, we'll have, for example, with landscapers, it's not unusual to have landscaping firms where individuals are hired in March and they work through October, the end of October. They're seasonal employees, but the problem is once they work more than 120 days during the calendar year, they're no longer considered to be seasonal and they have to go into that employee count. So 50 or more full-time equivalent employees is a very, very important number for everyone, but for people in the agricultural areas, that definition of seasonal employee is absolutely critical. Once we have 50 or more full-time equivalent employees, the penalty then would apply. The obligation applies. So, for example, if we had 35 full-time employees and then we have 20 part-time employees who all work 24 hours per week, these part-time employees would be considered the equivalent to 16 full-time employees. 20 employees, 96 hours in the month, gives us the equivalent to 16 full-time employees. They are enough to put the employer over the 50 employee threshold. Now, the large employer penalty, let's figure this out. The large employer penalty will apply when we're a large employer. So we have 50 or more full-time equivalent employees. And we either don't offer coverage or the coverage we offer is inadequate or too expensive. So beginning in 2014, if we're an employer with 50 or more employees, including those full-time equivalents, and we don't offer coverage, the penalty is equal to $2,000 for every full-time employee we have, minus the first 30 employees, provided any one of our employees, we're not offering coverage, people have to have coverage, provided any one of our employees goes off and gets coverage on the exchange, and the United States government has to help pay for it. So if we don't offer coverage and we have an employee that goes off on the exchange, Uncle Sam gives a premium credit or a cost-sharing subsidy. The penalty is $2,000 for every full-time employee we have, minus the first 30 full-timers. Quite honestly, for many employers, there are going to be many employers that don't fall into that penalty area because the 30 employee offset is going to really nullify their having to pay any penalty or much of a penalty whatsoever. That's the employer that doesn't offer coverage. Now, an employer, as I said, can be penalized in three circumstances. The employer doesn't offer coverage, or the coverage that the employer offers is inadequate or too expensive. If the employer doesn't offer coverage and the employee goes off gets coverage on the exchange and Uncle Sam has to help pay for it, not offering coverage is $2,000 for every full-timer minus the first 30 full-time employees. Now, if the employer offers coverage, but that coverage is too expensive or it is inadequate, well, now the employer is going to pay a penalty. The inadequate coverage has to be the equivalent to the bronze plan on the exchange. In each of your states, the state will be setting up an exchange, and that exchange is going to have levels of plans. The national, the statute really, the Public Act uses the term bronze, silver, and gold. You'll hear the term now metal plans. For some reason, people are picking up the shorthand to say bronze, silver, gold, referring to them as metal plans. The baseline plan is the bronze plan. So the plan that you have to offer as an employer has to be equal to the bronze plan in your state. If it is not, your plan is inadequate. Now, the other way you can be penalized is if the plan is too expensive. Well, what's too expensive? The statute says if the cost of providing coverage, if the employee's share of getting coverage is more than 9.5% of the employee's household income, and you have at least one employee that went off and got coverage on the exchange and Uncle Sam had to help pay for it, well, then the penalty is going to be either $2,000 minus the first 30 full-timers, or $3,000 for every one of those employees of yours that went off and got coverage on the exchange and Uncle Sam had to help pay for it, whichever is the cheaper of the two. So if your coverage isn't equal to your state's bronze plan, or it costs more than 9.5% of the employee's household income, and in either one of those two cases, an employee gets coverage on the exchange and Uncle Sam has to pay for it, it's the cheaper of $2,000 for every full-timer minus the first 30, or $3,000 for every one of those employees that got coverage on the exchange. I want to point out, and I'm sure some of you will be asking questions about how are we going to know whether the plan is too expensive, because we're not going to know the employee's household income. And the answer is that the United States government, the IRS, has issued a safe harbor that says we're just going to look at 9.5% of the employee's earnings from you, And if it is the plan you're offering is more than 9.5% of what the employee, the full-time employee, earns from you, then it's considered to be too expensive. Frankly, I think there's going to be more work that has to be done on that, because you're going to have employees that have, for example, if an employee goes off on a leave of absence, that person's earnings will be substantially reduced below the 9.5% threshold. But that's the large employer penalty. To whom does it apply? An employer with 50 or more full-time equivalent employees. When does it apply? When any one of the employees goes off and gets coverage on the exchange, and Uncle Sam has to help pay for it, and the employer either does not offer coverage, the coverage is too expensive, or the coverage is not adequate. And that's when the penalties are triggered. How much are they? Well, if you don't offer coverage, it's $2,000 for every full-timer minus the first 30 full-timers, or it's if you offer coverage but it's too expensive or it's not adequate, it's $3,000 for every person that gets that coverage on the exchange, or $2,000 for every one of your full-timers minus the first 30, whichever of those two penalty arrangements is cheaper for the employer. Now, if you do offer coverage, and that coverage is adequate, and the coverage is affordable, but the employee says, you know what, I'm not going to get coverage from you, employer, because if I get coverage on the exchange, Uncle Sam will help me pay for it, so I can get a better deal through the United States government. If you do offer coverage on the exchange, if you do offer coverage which is adequate and affordable, and an employee goes off and gets coverage on the exchange, you will not be penalized. What the government basically says is we are looking at the employers offering coverage which is adequate and affordable, is meeting his or her obligation as we see it, and therefore that employer should not be penalized. Now, again, I want to go to part-time and seasonal workers. With part-timers, we are going to prorate their hours. Really, it's the total hours worked by part-timers based on they're working less than a 30-hour week in a month divided by 120. With seasonal employees, we don't count them at all if they're hired on a seasonal basis and they are working less than 120 days in the year. The part-timers, though, will get you into the penalty area, but your obligation is not to provide, even if you're a large employer, a part-timer has no entitlement to receive insurance from you. It's an odd thing that the part-timers can get you into the large employer count, but they don't figure at all into the penalty. It's a very, very strange thing in that respect. Seasonal is a different story. If the seasonal employees fall outside that definition of seasonal because they work more than 120 days in the year and they work more than 30 hours or more in a week, they are full-time employees for purposes of this law. Now, grandfathered plans, so that's the penalty. And I think it's very, very important at this juncture to start looking at that matter of, do we have 50 or more full-time equivalent employees in the definition of part-timers and seasonal employees and what they do in terms of that employer count. Now, there are some allowances for what's called a grandfathered plan. I suspect that none of you have a grandfathered plan, quite honestly. But if you had a plan that was in effect on March 23rd of 2010, and that plan has never really changed in terms of the benefits or the cost to the employees in an appreciable way, there are special allowances for that plan. It's considered adequate coverage. But most plans are not going to be grandfathered plans. That's the large employer mandate and the penalty. Now we're going to take a look at implementation briefly for 2011, 2012, and 2013. Funding for health insurance exchanges. Implementation began last year and it's continuing. In several states, including Connecticut, for our Connecticut employers on the call, there's been grant money that's been given, and exchanges are in getting ready for implementation in 2013. We're going to tell you a little bit more about exchanges in your states. HRAs and FSA prescriptions have to be accompanied. They are only reimbursable. Costs for over-the-counter drugs are no longer reimbursable unless they're accompanied by a prescription. W-2 reporting, as I mentioned earlier, was delayed. Now in 2013, coming up with your 2013 W-2s, you're going to have on your W-2s the value of the health insurance you provide to your employees. There is a magic number here, and I want to present that number to you. It is 250, not employees, but W-2s. If you issued fewer than 250 W-2s in the prior year, you do not have to have W-2s which provide the value of health insurance coverage on them in 2013. It's not the number of employees, it's the number of W-2s. And for those of you who qualify for this W-2 requirement, the shorthand that you can use, you have to calculate and report the cost of the coverage that you provide. Now, the government has said this is not designed to tax employers. They know 1,000 times no. It's for an excise tax that's supposed to start in 2018 on Cadillac plans. The shorthand that you can use is take the COBRA rate for coverage minus the 2%, take off the, if you charge a 2% administrative cost, you remove that 2% administrative cost, and that gives you the value of the coverage that you put on W-2s. Non-discrimination testing. Plans will not be able to discriminate against highly compensated employees once the government has issued new regulations. Now that's going to be important for some of you. Some of you have organizations, I suspect, that say the people that are eligible for coverage are managers and above, or are supervisors and above. Once these regulations are issued, we're going to have to take a look at to whom we are making eligible for health insurance coverage, because these rules are going to say that plans may not discriminate in favor of highly compensated employees and exclude the not so highly compensated employees. Auto enrollment. As I said, in 2014, you will be automatically enrolling, if you're an employer with 200 or more employees, you'll be automatically enrolling people in your health insurance plans. They can opt out, but they have to be automatically enrolled. Now, there are, in terms of illegal immigrants and health care, there's a distinction with respect to immigration status. There is no exclusion for people based upon their alien status or any immigration restrictions that they have with respect to getting coverage on the exchange. But subsidies are only available to people who are lawfully present in the United States. Now, I think what is probably going to happen is we're going to see more coming up on immigration reform. And I suspect that sooner or later we'll be moving toward a national E-Verify system, and we'll be looking at healthcare reform as part of that E-Verify system.
Bob, this
Yes.
is Jim. Let me interject a question at this point that's been on the text chat here for a while. Would this cover H-2A employees, legal guest workers?
Yeah, yes, it will. Yes, it will. If they fall into that definition of a full-time employee, then the answer is yes. If they are seasonal employees, and again, that's why that definition of seasonal is so important, working fewer than 120 days in a year, then the answer is no. We don't need to count them as part of that 50-employee count. They don't count as full-time employees either.
Thank
but
you.
otherwise, yeah, otherwise there's no distinction. In terms of the illegal immigrants, you know, there's going to be some refinement of the matter of the status of the illegal immigrant and health care. But I think you're going to see that immigration enforcement and healthcare enforcement are going to be somewhat related, and I suspect we're going to see a common database, but that remains to be seen. Let's talk about what's going on in individual states. Under the Affordable Care Act, the ACA, each state has to establish a healthcare exchange. Now, there have been 6 or 7 states that have been particularly active on this. Some of the states have fallen behind. Some of the states have said, for example, New Jersey said, no, we're not going to, federal government, if you want to set up an exchange, go ahead. But let's take a look at the states in which our attendees on this call are operating. Connecticut is one of the leading states in terms of development of the exchange. Of the 6 or 7, Connecticut and a few others are out in front on this thing. So Connecticut has defined its essential benefits already. Connecticut just came out on November 12th with the definition of essential benefits, and Connecticut is full speed ahead with creating a state-based exchange that should be operating in October of 2013. Massachusetts is very interesting because, as I said earlier, Massachusetts enacted its law in 2006, and it became effective in 2007. And the Massachusetts Healthcare Connector is the model for it is the federal model for exchanges, I suspect. What Massachusetts is doing, though, is they're taking their existing law and now they are incorporating into the Healthcare Connector the elements for federal compliance. But Massachusetts is way, way ahead of the pack in terms of compliance with this law. Rhode Island has enacted 3 special laws that will bring Rhode Island plans into reform compliance. And Rhode Island has established, just like Connecticut did, an exchange board, and as Massachusetts has done. So Rhode Island is moving forward with the development of a state exchange. New Hampshire, on the other hand, said, we will not set up an exchange. We'll defer to the federal government. As New Jersey said, we're going to defer to the federal government. And if the federal government is saying, you have to have an exchange here in New Hampshire or we'll set one up, New Hampshire is saying, we'll go ahead and set one up. We'll defer to the federal exchange. Now, New York, the New York legislature failed to pass an exchange law whereby New York would set up an exchange. The governor then took, even though it didn't pass by law, the governor took and by executive order said New York will be setting up an exchange. We're starting to see other states doing the same thing with setting up an exchange. Some of them are active exchanges. I think Massachusetts and Connecticut will serve as the model of active exchanges. I suspect Rhode Island will follow suit. You'll see other exchanges that are passive. Utah would be an example of that, where they're basically informational exchanges and don't really do much in the way of enrollment. You probably see California being one of the more active states. But how an exchange operates in your state is going to be determined on a state-by-state basis. But if you look to Massachusetts, if you want to see what a health insurance exchange, active exchange looks like, go to the Massachusetts Healthcare Connector. You'll see plans that are offering exchange-based plans, and people will have an opportunity to put in information about themselves and have that information filtered through to say, these are the plans that are available to you, and here are the costs of those plans. That's a very active exchange structure. Connecticut will have the same thing. I suspect Rhode Island will have the same thing. California will have the same thing. New Jersey. The New Jersey passed a law to establish a health insurance exchange that went to the Department of Banking and Insurance. It's independent of any supervision or control. However, the governor vetoed that bill. and then the question is whether or not there'll be an override on that bill. So now we're seeing healthcare reform going from a political issue to legislation, federal legislation. After that federal legislation took effect, it impacted institutions like health insurance companies and hospitals, Medicare, Medicaid, and a variety of other institutional entities. Then healthcare reform starts having an impact on a state level. So after we move through the federal level and the big impact on carriers and hospitals, then it moves down to state government, and state government having to set up exchanges or stepping aside so the federal government will do that. And now we're approaching the final step in terms of entities affected, which is the employer talking to employees about the cost of coverage on the W-2s, the quality of coverage on the SBCs, the summary of benefits and coverage, then saying to employees, here's information about the Rhode Island exchange or the Connecticut exchange, and you have to have adequate and affordable coverage or you're going to pay a fine. And then employers saying, and our coverage is either meets that definition or not. So I think in terms of where we are, in terms of healthcare reform, we're now at the point where employers are talking to employees and are being required to talk to employees about healthcare reform and the status of their coverage. And then the last step is going to be every individual taxpayer and every large employer reporting to the federal government about the status of their own coverage. It comes down in 2014 to an individual obligation, an individual report. So I think for us on the call, what this means is we need to anticipate in our organization communication. Your employees are going to turn to you at some point and say, we're supposed to have coverage, I'm supposed to have health insurance coverage which is adequate, and if not, I have to pay a fine. Is our coverage adequate or isn't it? And you are going to be reporting to the United States government about your plan and who's enrolled in it and what it costs and whether or not that plan is adequate. So I think you want to anticipate there's going to be some communication obligation that's ongoing. In terms of next steps, I would say it makes sense to start looking at healthcare reform strategically. Seasonal workers, unless there's a change on this definition of seasonal worker, and frankly, I have no expectation that will change. You have to look at the impact of the seasonal workforce and that definition of seasonal workforce on your organization. Remember that the seasonal employees count. Once they've worked more than 120 days, they're no longer seasonal. They're just full-time or part-time employees. So you can, one of the strategies is to limit the number of work days, or if not, the question is whether or not those seasonal employees are going to apply for coverage on the exchange and get a helping hand from the federal government. The next element to consider is the benefits strategy. Now, employers, one of the things that employers will often say is, well, look, if the penalty is $2,000 for every full-timer minus the first 30 full-timers, I can drop this coverage, pay the fine, and save a whole lot of money. And I suppose that's true. The problem is that most employers in Massachusetts did not do that. And most employers throughout the United States are not expected to do that. And quite honestly, the employer that drops coverage, the first employer to drop coverage in the labor market, it's automatically at a competitive disadvantage if the other employers are providing coverage. 165 million Americans get their coverage through the workplace, and it's not required. The estimates are that very, very few employers are going to drop coverage, but one of the things that comes into play is to consider the benefit strategy. It's called pay or play. Well, okay, if we're not going to play, that is by providing coverage, will pay. We'll pay the fine, or we'll pay the fine and give employees money to get coverage on their own. The other element to consider in terms of next steps is benefit strategy. There's got to be some consideration here of paperwork on benefits. There's a uniform coverage summary that you should have gotten from your health insurance carriers, and you'll be providing and should have been provided to your employees. You do that on an ongoing basis. We've got to get those W-2s out to our employees in 2013 that has the value of health care coverage on them. And then we also have to get information about the Connecticut or Rhode Island, New York, New Jersey, New Hampshire exchanges. In the case of New Hampshire and New Jersey, even if the exchanges are federally run, nonetheless, we have to get that information out. So now what we have to do is look at healthcare reform, both strategically and operationally, in terms of giving us some things to consider about our planning and then some things to do about communication. Having said that, I think we're at the time where my commentary is concluded, and we can open the floor to questions, if there are any.
Bob, I've got a number of questions for you. No surprise. But first, thanks for a great walkthrough. All of that stuff, very systematic, very detailed, and I'm sure that's going to be helpful. Let me start. I'm going to start with my own question, but I want to do kind of a reverse auction with you and just make sure we kind of got the key points focused here. And so I'm going to give you different employee levels and kind of ask you to summarize what the to-do list for that business owner is. So let's start with somebody who's got 5 or less FTE employees. By the new definition here, 5 or less, what's their to-do list for 13 and 14?
Okay, that's relatively easy. Let's talk about what's not on the to-do list. No W-2s, no auto enrollment, no obligation to provide any health insurance coverage. All they have to do is get information out about the state healthcare exchange, and those 5 employees will have an obligation, once the employer has provided that information about the healthcare exchange in their individual states. Those 5 employees are going to have an obligation to go out and get their own coverage, but that matter is between them and the United States government and doesn't involve the employer whatsoever.
Okay, let's move it up to, say, between 5 and 15 employees. Anything change?
No, nothing changes in that respect at all. It's the same thing. No obligation to provide coverage, no W-2s, no fine or penalty that we have to worry about, just information about the exchange in your state, and then the employees have to go out and get their own coverage, and then it's between them and the United States government.
How about 15 to 35? Does anything change?
15 to 35 would not change, except, well, let me go back just one step, though. For our folks in Massachusetts, 11 or more employees is the magic number, and they all know that because they've been dealing with it. But otherwise, the answer is no. 15 to 35 has no particular obligation. Now, there may be some health plan reporting that employers will be required to do at some point along the way, but at this point we don't have that. So our employer with up to 35 employees has no special obligation unless we have, in addition to those 35 employees, part-timers who might be the equivalent of full-time employees. But assuming our number 35 includes part-time and full-time, there's no real obligation.
Now, I picked the 35 strategically because I think you're going to tell us somewhere around, 35 and above, we got to start paying very close attention to whether we're going to, kind of inadvertently wander over the 50 minimum. So
it's absolutely critical, and you're absolutely right in identifying that number is around 35 or so. For everyone on the call, I would say that, frankly, lawyers are always like sailors carrying around an extra anchor just in case. It wouldn't be a bad idea if somewhere around, I don't know, 25, 30, 35 employees or so, if we have a lot of part-timers or if we have a lot of seasonal employees, there are two things we want to do. We want to look at those part-time hours and express them as full-time equivalent employees. And of our seasonal workforce, we need to look really at whether or not those people would remain defined as seasonal as this law is defining it. That 120-day rule is very, very important. So you're absolutely right. 35 employees, we've got to pay attention to seasonals and part-timers.
And then 50 and over, you've done a great job of outlining lots to do on the to-do list, and I think, I don't want to say it's straightforward because it's a lot of implementation and education and strategy on the part of those employers, but clearly they are right in the crosshairs of all of this.
They are, yeah, and it just comes down to, I think the problem for the employer with 50 or more employees, the larger employer, the hard part is not so much the not having coverage. That's pretty straightforward. I mean, it's if you don't offer coverage, you drop the coverage or you don't have it, it's going to be $2,000 for every full-timer minus the first 30 full-time employees. And I think for some employers from a dollar and cent standpoint, they say, well, that's really a bargain. It's not so great from an employee relations standpoint or from a matter of competition. The harder part will be for employers whose coverage is not affordable. And currently, the way it's defined, if the cost of coverage is more than 9.5% of the employee's income, then it's not affordable. Unless we get further guidance from the IRS on this, we're really put in we are put at a disadvantage because there are too many contingencies with earnings that make this a difficult standard to administer given the way it's currently structured. So the example I've used is the employee who's normally earning a certain amount of money, but this year went out on workers' comp, and that person's W-2 earnings may or may not have fallen, or the person goes out on unpaid leave, and the W-2 earnings have fallen. So we need a little more guidance on that.
Okay, I'm going to move to the participant questions, Bob, and okay. Again, if a long answer is appropriate, fine. I think some of them though are yes, no, they gotcha type of questions, but okay. I'll let you use your excellent judgment on that. So first question, if you have less than 15 employees and provide coverage to some employees that have been with us for 15 years but do not offer coverage to new or non-foreman jobs, do we have to now provide coverage to everyone?
No. The magic number is 50 for the obligation to provide coverage. The only other area that could be a problem is if you offer coverage only to your highly compensated employees and not to the non-highly compensated employees. If the plan discriminates in favor of highly compensated employees, then and only then it could be a problem. Now, the non-discrimination rules have not been issued, and we've got a long way to go on that. But the short answer is no, it shouldn't be a problem. There are only two things that will come into play. One is this. Well, if you're only giving it to the highly compensated employees, that could be a problem. I suspect that the law has a definition of highly compensated employees, so even then the managers may not qualify. The other thing, though, I'd like you to check is that if you have an insurance contract, if you're getting your health insurance through an insurance carrier, and you may have a contract that says we will provide enrollment to any full-time employee working 30 hours a week or more. So if we have an insurance contract from a carrier, and that contract says we're going to offer coverage to all our full-timers, but our practice is to only offer it to our managers, then that could be a problem as your contract is written. But otherwise, those are the only two areas.
Okay, let's review again. What is seasonal? If I have employees that work less than 120 days over a 9-month period, can they be classified as seasonal?
Yes. A seasonal employee who is one who is hired on a seasonal basis. So the condition going in is you're a seasonal employee and the person doesn't work more than 120 days in the calendar year.
Next one, will keeping one's workforce one below the minimum raise any red flags with the U.S. government?
No, it won't. And I have a lot of employers that say, whatever I do, I'm not going to have 50 employees. And you know, I've heard that before. So, for example, with 50 employees, you have an obligation under the Family Medical Leave Act. And with 50 employees, you have an obligation under a sexual harassment prevention training law in Connecticut. And so it's not unusual for employers to say 50 is the magic number. The federal government loves the number 50, so I'm just going to keep my workforce at 49. Does it represent a red flag? The answer is no.
Okay, next one's from one of our very senior tax practitioners around here, and you'll see where he's coming from, but kind of a two-part question. Are there common paymaster rules that prevent similar entities from separating employees into smaller groups?
Yeah, they're not common paymaster rules, but they are control group rules that will apply. And so if you have common control or common ownership, then the workforces will be aggregated, and that comes up we've had a lot of questions related to that. So the control group, the Public Act clearly states that the control group rules will apply, the control group rules under the IRC, so they will apply.
So going out and creating 2 more LLCs and farming out some of the employees around is clearly not going to be a working strategy.
That won't be a working strategy, no.
The second part of that question, did I read correctly that the penalty is not deductible for income tax purposes?
Yes, I believe you read correctly. The penalty is not deductible for income tax purposes.
All right, next question. Could you please clarify, if an employer provides coverage that is adequate and affordable, they will not be penalized. However, the employee can still go out and purchase insurance through the exchange and receive assistance from the government.
Yeah, the way that question was stated was absolutely correct. That if the employer offers coverage which is adequate and affordable, we've got an employer with 50 or more full-time equivalent employees, the coverage that's offered is adequate and affordable, and the employee says, no thanks, employer, I'm not going to enroll in your coverage, I'm going to go off and get the exchange because Uncle Sam will help me pay for it. Well, the employer has met his or her obligation as an employer. The employee can go off and get coverage on the exchange. The employer will not be subject to a penalty.
So they've safe harbored themselves.
Correct.
Very good. Next question. Is the 120-day rule consecutive days or over the entire year?
The way it's stated now, it is not consecutive days. It's just 120 days over the entire year.
So again, got to have a good payroll record-keeping system. Got to be keeping track of people that kind of come and go during the year.
Oh yeah, definitely so. I actually think that for some employers in agriculture or in the green industries, that they're going to have to be very careful about the timing of employment. In some of the clients we've been dealing with, I can almost envision having staggered workforces, the seasonal workforces, so that they are staggered in terms of their hire date and their termination date to avoid that 120-day rule.
Good advice. Next one. Will it be mandatory for the employer to offer a family insurance plan for every employee over 30 hours per week, or just single coverage?
The mandate applies to the individual to have coverage for himself or herself and that person's dependents. The coverage that's offered on the exchange has to be family coverage. The employer does not have an obligation to offer, does not have a requirement to cover anyone other than the employee, him or herself. The employee's got an obligation to have dependent coverage, though.
Okay.
So if the employer doesn't offer it, the employee has to go out and get it.
Are there special rules for employees who elect to be covered by their spouse's employer plan? Very common in agriculture.
Yeah, not yet, but I suspect that there will be. So right now, as it's written, there's no provision for coverage that the employee who opts out because he or she has other coverage, but we're bound to see that. Now, we've gotten 3 sets of proposed regulations that came out on November 20th. There are going to be more, and I can almost assure you and the callers that, yeah, they have to make an allowance for the employee that says, employer, I'm not opting for your coverage because I'm opting to be a dependent on my spouse's plan. So that's not there yet, but it will be.
And that raises a good point, and you've kind of said this, you know, between the lines a number of times here, Bob, but there's going to be a lot of different rule-making pronouncements to this whole thing over the next, I got to believe, 18 months or more, correct?
Yeah, definitely. You know, what's happened is just as a lot of states were waiting for the Supreme Court decision and, you know, the political intrigues on this, the federal government is also been kind of caught short on aspects of this. So, for example, there was an article in the New York Times about a month ago where it was reported that the federal government really was not prepared for states saying to them, go set up the federal exchange. We're not going to set one up here in New Hampshire. Go ahead, set one up. And they didn't plan on 26 or so states turning to the federal government saying, okay, set up the exchange, and the federal government doesn't have the capacity to do that right now. It's the same thing with regulations. I actually think that employers are, I don't think the law has considered yet all those little special nuances and arrangements that occur in the workplace. And so this example of the employee saying, no thanks, employer, I don't need the coverage. I'm going to be covered under my wife's plan or husband's plan. Right now, that isn't written in, but there'll be regulations to that effect. There have to be.
Next question. Will we be able to purchase through exchanges over state lines?
Well, the law, that's a very good question. If states want to establish interstate compacts, they can do it. I don't know of any states that have done that at this point, but if the states allow it, and if the plans offered in those interstate compacts meet the essential benefits definition in that state, then there's nothing in the law that prevents that from happening. But right now, I don't know of any plans for interstate exchanges, but there would be nothing that would prevent, for example, the New England states from forming one New England statewide region, but the plans that are offered in each of those states have to conform to the minimum benefits definition in that state.
Oh, come on, we're New Englanders. We have a hard time agreeing on much of anything, Bob. So.
I know. You know, the law does contemplate the interstate sale of insurance. Right now, insurance is sold on a state-by-state basis, but it does contemplate the interstate sale of insurance and these interstate exchange compacts. We just don't see any of them arising.
I think the next one gives you kind of an opportunity to review and recap a little bit, but what are the penalties a business with less than 50 employees might incur?
Oh, that's great. And let me be very, very clear about that. A business with fewer than 50 employees, now let's just qualify that definition. a business with fewer than 50 full-time equivalent employees has no obligation to offer coverage, and it will incur no penalties as a function of this law. If you have fewer than 50 full-time equivalent employees, it is basically an obligation of your employees to have health insurance coverage, but it is not an obligation of your organization to provide it. There's no penalty. The only exception would be if the state, like Massachusetts, drew the line in a different place, and Massachusetts draws the line at 11 employees. Well, then that's between the employer and the Commonwealth of Massachusetts. But as far as the federal government is concerned, the magic number is 50 FTEs, full-time equivalent. Below that, you have no obligation.
And I think, and maybe that's a fair takeaway from this too, to the extent that we have some folks from Massachusetts on this phone call, probably not much changes for them. Is that correct?
Yeah, that's correct. They've already gone through all the heavy lifting of the mandate of the fair share responsibility. Massachusetts has had some HERT forms, that is some health insurance reporting that they've had to do. The folks in Massachusetts are old hands now at healthcare reform. They've already been through it, so the federal government is basically doing the work they've already done.
So next question. The farm pays for 75% of the health insurance premiums currently for the employee that qualifies for our program. What happens in 2014 if the farm continues to pay this portion and the employee's 25% is more than 9.5% of their income? How does that work for the penalty? The farm
we need we're going to need some further definition on that 9.5%. As I said, there's too many nuances in the workplace, but let's look at the shorthand. The farm is offering, first of all, let's say we have a farm with 50 or more full-time equivalent employees. The farm is offering coverage, so we don't have to worry about the penalty for not offering coverage, and let's presume that the farm is getting their coverage through an insurance company, so we're going to presume that that coverage is meeting the essential benefits definition. The only problem is that the 25% that is paid for by the employee costs more than 9.5% of the employee's income, that 25%. If that employee goes off on the exchange and gets coverage, and that employee gets a premium credit or a cost-sharing subsidy, the United States government is going to turn to that farm and say, now you owe us either $3,000 for that employee and every employee just like that employee, or $2,000 for every full-timer you have minus the first 30, whichever is the cheaper to you. So what employers will do under those circumstances is say, well, maybe what we should do is pay more than 75% so we don't have to worry about that employee's 9.5% threshold. But to answer your question, if the cost of the employee pays 1/4 of the premium, the employer pays 3/4. If that 1/4 the employee is paying costs more than 9.5% of what that employee is earning from the employer, and that employee goes off and gets coverage on the exchange and Uncle Sam has to pay for it, the United States government is going to say to that employer, you have to pay a penalty. What is it? Well, it's $3,000 for this employee, or $2,000 for every full-timer minus the first 30 full-timers, whichever is cheaper to you.
Okay, next question. We're getting towards the end of the list, I think, but they're great questions and really help us drive home the conclusions here. So I'm going to keep going through them. Farm laborers often go from farm to farm during season. Is my assumption correct that as long as they stay below the 120-hour threshold at each farm, 120-day threshold at each farm, then no one employer is liable for providing coverage?
That's correct. The way the law is currently written, it really pertains to 120 days with an employer, a single employer. So if we have somebody that goes from farm to farm and all those assignments are less than 120 days, even though in the aggregate it is more, the person's worked more than 120 days, none of those farms are subject to a penalty.
Okay, next question, and I'm guessing that Lisa is thinking this through backwards and forwards. It's another great question. How are number of employees calculated if an employer owns multiple businesses? Let's just say a grape grower that has vineyards and also owns a restaurant. Let's put those businesses in separate entities. So a sole proprietorship that's in the vineyard business and an LLC that's in the restaurant business. How's that work?
Well, again, that's going to go down to the come down to the law saying that the employers will be aggregated. We're going to count if the workforce is, I'll just give you the shorthand, if they're under common control, that is, they're under common ownership, or they're under common labor relations policies, or they are contributing to a common enterprise, then they're going to be aggregated. They'll all be counted as a single employer.
Okay, next question. If the important number is becoming 100 FTEs on 1/1/14, why do we worry about 50 FTEs?
I don't know that the important number is 100. I think the important number is 50 full-time equivalent employees, and because that's the number that triggers an employer's responsibility to provide adequate and affordable coverage. So I don't know that the important number is 100. I hope I didn't state that. It's the 50 full-time equivalent employees is what triggers the mandate, the requirement for an employer to offer coverage.
Okay. I think the next one may be an editorial question, but I'm going to give it, or an editorial comment rather, but I'll give it to you anyway. How can it be affordable in New Jersey? We have so many mandates already for coverage.
That's a good question. You know, I hate to sound flippant, but one of the things you're going to find, all of us will find, is that there is nothing in the Affordable Care Act that makes the coverage affordable. And so, you know, there have been estimates on whether exchange plans are really going to be cheaper than non-exchange plans, and there's no meaningful cost mechanism or cost reduction mechanism in the Affordable Care Act as such. Now, there was supposed to be some curbing of the mandates. So in every state, you know, the state will say, well, if you're going to sell insurance, health insurance in Connecticut insurance company, you have to have all these benefits as part of that. Now, in the law itself, and New Jersey would be an example of that. New York it tends to be very mandate heavy as well. There was some mechanism to provide that if a state had a lot of mandates, then they would incur essentially a form of penalty. That gave way, though. That concept gave way to some proposed regulations that basically say each state, like New Jersey, can determine what's going to constitute the minimum essential benefits for that state instead of having a federal standard for that state. And then they went on to say that for 19 to 30-year-olds, there's going to be an allowance for catastrophic plans, so the younger people can get a level of coverage which is through the exchange, which is cheaper than a conventional plan and won't cover as much. But I'm sympathetic to the editorial question or comment that says, you know, New Jersey is an expensive state for coverage. Connecticut is, Massachusetts is. A lot of New England states, frankly, are. And there's nothing in the Affordable Care Act that really says the coverage is going to be affordable.
I am going to make an editorial observation of my own. I think the affordable was more a marketing
yeah,
point
right.
than an accurate descriptor. But
absolutely.
I've got I'm going to take 2 more questions. I've got way more than that. I am going to assure those of you who we don't get to your questions, it's not because they're not great questions, but we're going to stay close to the 90-minute timing here. So we will keep track of those questions. If your name is on them, we will work with Bob to get them answered for you
sure.
and get back to you with them.
So,
next question, next to the last one. If the employer has an adequate plan and employees go on to the exchange, does the employer still have to pay part of their coverage?
No. If the employer has an adequate plan and an affordable plan, and the employees go off and get coverage on the exchange, well, the employer, they can do that. The employer has no obligation. If the employer's plan is no longer affordable, though, I mean, I guess what we're contemplating is an employer. Sounds like we might be contemplating an employer saying, okay, you folks have gone off and got coverage on the exchange, so now we're going to cease our contribution. That would just lead to a further problem. But if the employer is offering coverage and the coverage is affordable and the coverage is adequate, yeah, the employees can go out and get coverage on the exchange, and Uncle Sam can help them pay for it, but the employer will have no penalty whatsoever.
Okay, last question, and for today anyway. If the employee chooses to purchase insurance through the exchange instead of taking part in the affordable and adequate employer-provided insurance, will the percent subsidy they receive be different from that of an individual who is not offered adequate and affordable insurance?
No, that's a very good question. That's a great question. The answer to it is no. And it's a very strange thing where the United States government is saying, well, even though your employer is offering you coverage and it's adequate and you can afford it, nonetheless, if you get coverage through the state exchange, we're going to help you pay for it. And the fact that you decline coverage with the employer does not play any role in the amount of the subsidy that the employee is entitled to receive. That's a great question.
Hey, one last question, because it's I think something that we can do offline and put the information on our website, Bob. But where can one find information on their state exchange now? I assume that some of the states that have been kind of ahead of the curve here have probably posted some information. Is that correct?
Yeah, yes, they have, and that's a great question. You can go on, there are 2 places I think you want to go. I think you can go on to the Department of Health and Human Services website, and you can get information on the state exchanges. And then if you go on to the Kaiser Foundation website, you can get some excellent information from there as well. So either one of those 2 sources. Of the 2, I think you find a lot more insight on Kaiser than you will from the Department of Health and Human Services. But either will give you information. Then the other thing you can do is just put into the your search engine your state name and put in Health Exchange, and I'm sure you're going to see some response from that. So put in Connecticut Healthcare Exchange and see what comes out. Okay,
I'm going to wrap the questions there. Chris Lawton, our Director of Knowledge Exchange, is going to go find those web links, and we will post those in an appropriate place on our website as an informational resource on this. The recording of this session will be posted on our website, and it's there for other farm credit customers who wish to go in and look at it. So if you recommend this to a friend, tweet it or whatever over to them, we'd appreciate that. If they have issues with access to our website, have them call their local office, and we would be glad to assist them with that. But our goal with these is not to restrict them just to those of you who took the time today. It really is to help all of our customers. So that's for those of you who've asked questions, where can you get the material and so forth, we will post, and I believe there will be a follow-up email with the appropriate links and so forth. I want to do a quick commercial for our next webinar, which is a week from today. Same time frame, 11 to 12. It's titled Food Hubs, What Are They and Why Do They Matter to the Northeast? A lot of buzz out there about local foods movement and getting more foods, locally produced foods into consumer channels, school lunch channels, community feeding channels. And those can be very important to us here in Northeast agriculture. We've got two speakers, James Barnum from the U.S. Department of Agriculture, has done a lot of work in this area, and Malini Moragan from the Wholesome Wave Group in Bridgeport, Connecticut. So we're really looking forward to that. Again, encourage you to sign up for that. The last request I've got of our participants today, I see a lot of familiar names, and really appreciate that. But if you've got suggestions for topics for next year, suggestions for how we can improve the usefulness of these webinars, please share those with the folks that you work with in our local branch offices. They'll get them, those comments to Chris and Christy here in Enfield. But we'd really like to hear from you on all of this. We want to make this better and even more valuable to you next year. That concludes the commercials. I want to give just a tremendous thank you to Bob for his work with us this morning. This is the second time he's done this with us here, and you've just got a remarkable knack for sorting through a very complicated, let's face it, very emotional for just about everybody set of issues here. And I think we kept the politics out of it this morning. We dealt with all sorts of issues here. We recognize that there's more to follow. And so you've just done a wonderful job. Again, I'll give him a little commercial here, because I think anybody who would like to work one-on-one with him can do that. And he is Robert Noonan and Associates, Employment Law and Human Resources Solutions in Middlefield and Meriden, Connecticut. And I suspect, like most good attorneys, you're always looking for additional clients, right?
We're a very busy firm, but we're happy to provide services to anyone that needs them, sure. And thank you so much. And I really appreciate the opportunity to, it's so great you're allowing us to come together and talk about a topic before the conventional press starts throwing too much emotion in this. This is a great opportunity to talk coolly and rationally, I think, and to deal more with light than heat. So I appreciate the opportunity, and I hope that the comments have been useful to our people on the call.
That's a great, I'm going to take one more takeaway from that comment, Bob, and yeah, this is, it's on the talk shows, it's on the in the daily newspaper, it's getting talked about in the coffee shop, and from a business point of view, regardless of what your political view is on all of this, but from a good business standpoint, best place to get information is from the experts who give it to you unemotionally, rather than to believe everything you hear on the talk shows. There's a lot of hype out there.
Absolutely.
And a lot of inaccuracy.
Absolutely.
So with that, again, thanks everybody for getting together today. We hope to see a lot of you again next week. If we don't, happy holidays. Thank you so much for your patronage of Farm Credit East. We value our relationship, and we look forward to working with you in 2013.